Today I'll be discussing breast cancer. For a little bit of background on the disease, according to the Centers for Disease Control and Prevention, also called the CDC, which is what we probably know it better as, breast cancer is a disease in which cells in the breast grow out of control. There are different kinds of breast cancer. The kind of breast cancer depends on which cells in the breast turn into cancer. It can occur in any part of the breast. The most common parts are the ducts, the lobules, and the connective tissue. And again, like we saw in the slide before, where the cancerous tissue is determines the type of breast cancer that the patient would be diagnosed with. The most common types include invasive ductal carcinoma and invasive lobular carcinoma. So those are the ones that you'll see more often. And of course, when people say that they have breast cancer, or even maybe when a doctor tells them that they have breast cancer, they may not understand these terms and the differences between them. But it is important to know so that when the cancer is treated, they know how to treat it and where to treat it and just the best course of action for it. Some of the most common signs and symptoms of breast cancer are a new lump in the breast or the underarm, swelling of the breast, dimpling or irritation of the skin on the breast, nipple discharge, pain or tenderness, and any change in size or shape of a breast. So as you can see in this photo here, there is a campaign called Know Your Lemons, and it was started because an individual who wanted to increase breast cancer awareness wanted to be able to post things online about knowing how to spot changes in your own breast, but obviously they were not permitted to post pictures of women's breasts online, so they used lemons in order to demonstrate the differences or changes that could be occurring in an individual. And it's a really impactful campaign because it allows people to look at this image without shame. It allows it to be posted anywhere and everywhere in order for the most amount of people to see it. And I think it's a really good visual just for anyone to be aware of, to see these different signs or symptoms and then say, okay, because of this change, I'm going to go to the doctor. And as it's stated on the slide, while any of these symptoms may be caused by a number of other things, it's always recommended to have any change in your breast examined by a doctor, and they might send you for more testing, or they may be able to tell right there, then and there, if it's nothing, but you definitely would want to see a professional in order to really understand what these changes mean. So cancer is the second leading cause of death in the United States. It's only behind heart disease in causes of death, which is really crazy. It's actually the cause of 1 in 4 deaths in the United States. Now, that's not breast cancer in particular, just cancer in general. But in 2018, there were 254,744 new cases of breast cancer. So that's about 127 new cases per every 100,000 women. And as you can see in the picture on the right there, 1 in 8 women in the US will develop breast cancer in her lifetime, which is crazy because I'm sure you can imagine you and yourself and 7 other women in a room. I'm sure you've been in that situation before, and to imagine that one of you will develop breast cancer in your lifetime is a little bit of a scary thought, and also just tells you exactly how common and prevalent this disease is. There are some risk factors for breast cancer, the first being family history and genetic mutations. Age, as you get older, your risk of breast cancer increases. Reproductive history, people who started menstruating before the age of 12 and who started menopause before the age of 55 may be at higher risk of breast cancer. Individuals with dense breast tissue are also at a higher risk. Those who use hormones for various reasons, and also lack of physical activity or obesity after menopause can increase the risk of breast cancer in some women. Of course, this is not an extensive list, and many of these risk factors are not changeable, like family history and genetic mutations cannot be changed, and really for those individuals, there's nothing that they can do. It doesn't mean that if you have a history of breast cancer in your family that you are definitely going to experience it, but it allows you to know that you should be maybe a little bit more aware and stay on top of those prevention techniques that are available. These include regular self-breast exams. There are many resources that detail how exactly women should be giving themselves breast exams. Doctors also are an amazing resource for this, and they will usually explain how to do that. Along with that, regular doctor visits, of course, to a primary care or a gynecologist are so important for women. A screening mammogram after the age of 40 is recommended for all women in order to detect breast cancer early if it is there. And of course, this screening mammograms may be started earlier than 40, depending on family history or personal history. So that is another reason to see your doctor, so that all of that history can be detailed and known so that you can get this prevention as soon as possible. Screening mammograms are a really easy and effective way to detect breast cancer. Another prevention method is to maintain a healthy lifestyle. Of course, that's not possible for everyone, and that will look different for everyone. The healthiest person could be diagnosed with breast cancer, but it is a form of prevention in this case. And of course, there are many treatment options for those who are diagnosed with breast cancer. They include surgery, chemotherapy, hormonal therapy, biological therapy, and radiation therapy. So the type of treatment that a breast cancer patient may undergo really depends on the type of breast cancer that they've been diagnosed with, the severity of it, and just their personal health history. So speaking with a doctor or a nurse navigator is so important in figuring out exactly what the best course of treatment is for these patients. And I'll end by saying that breast cancer awareness is so important because it can be detected so easily, and because it is so prevalent. It is so important that we spread the word and continue to make individuals aware of breast cancer and how to prevent it, and just the knowledge that it is treatable. Thank you.